I wanted to go through the folks that worked on abstracts for each of the meetings to go ahead and present. And we're going to have Dinah go first. I will jump right in, and Dinah, let me know when you're ready to advance.
Great, thank you. So these are actually 4 posters primarily submitted by Dr. Yap. I happened to go over some of this information with him. They were probably the 4 patients that represent his first 4 positives. And so this first one is one of his patients who was an African-American male who was always followed by his service for uncontrolled hypertension. And then he was also given a biopsy was done that did show collapsing FSGS. And so there was another hospital admission, and following that, they ordered Renasite. And sure enough, Renasite showed a certain very likely explanation for his disease with a single COL4A4 variant that we know just a single one could represent Alport syndrome in this glycine domain that is pretty important for function of this gene. So we see many of these changes, this one of them in a single variant just by itself. But then also he had a homozygous G1 allele for APOL1. And so it is really, you can go to the next slide. He concluded that, so really it's been, if at all reported, and he's saying has never been reported, so I'll go with that. The concomitant inheritance of these variants, this is probably one of the first times, although there is, we have many cases like this now, and really proposing that doing a broad panel testing can uncover all of the genetic possible underpinnings of renal disease, with the idea that together these 2 variants may exacerbate somebody's disease that you would think may not be as severe if they were not seen together. Probably his most thought-provoking abstract, and we can go to the next one.